Going a little late. Welcome to the third session of Health and Homelessness, and happy Cinco de Mayo. 10:05 classes, and make sure to log your 6 hours of outreach. So today we have Lieutenant Commander Reyna, who is a commissioned officer with the U.S. Public Health Service, and is the Regional Minority Health Consultant for Region X, which includes Alaska, Idaho, Oregon, and Washington. So everyone please welcome Reyna.
Yeah, I was ambushed on that picture. I was heading out of town. I was being deployed, and it got me in that picture. Now every time I try to find anything, any information or anything, that always pops up, and people always send that to me as a joke. So, like I said, my name is Reyna, and I'm with the U.S. Public Health Service, and I've been a commissioned officer for about 4 years now, working at the regional office here for the Office of the Secretary for Health for about 12 years. I've been working on HIV and AIDS programming for the Pacific Northwest, and then also preparedness programs. And I've been in my position for about 4 years now, working as a lead for minority health in this region for the Office of Minority Health in DC, and working on family planning issues. I'm the project officer for the state of Washington, and then a small Planned Parenthood in Oregon. So I've gotten the opportunity to do a lot of different things with my career. And, but one thing that always pulled me back is working with farm workers. I was a farm worker myself as a kid. Had been working in the fields since I was 5 years old until I graduated high school. I actually left Yakima to come to go to school here at the University of Washington. So this population is very near and dear to my heart because of all the health issues and a lot of barriers and just everything under the sun that affects this community. So feel free to ask me any questions as we're going through. I don't want to feel like I'm just up here talking the whole time. But I'll go ahead and start with some of the demographics for this population. And start off with the definition for this community. And then I know this is you guys focus on homelessness and individuals, but I think, I looked up the definition for homelessness, and it basically meets a lot of the definitions of these community and migrant health centers, community and migrant, migrant and seasonal farm workers. So seasonal farm worker is someone who, their principal employment for 51% of their time has been in agriculture for the last at least close to 2 years. And then for a migrant farm worker is someone who meets the same definition as a seasonal farm worker, but establishes a temporary housing when they follow the crops wherever they're going, following the season. This slide's pretty busy, but just to give you a quick sense, these individuals, predominantly a lot of them foreign-born from Mexico. Close to 50% of them are not authorized to work in this country legally, but they are. Majority of the men away from their families. So you can tell that there's a lot of issues with that as well when you have single men going around. It can lead to a lot of different health issues when they're away from their families that kind of ground them. A lot of them, about 70% of them have issues with speaking English, and tend to be fairly young because working in the fields is very physically demanding. You're working 12 to 16-hour days, almost 7 days a week when the season is at its peak. And you look at the highest educational attainment, it's about 8th grade on the average, and then their income is very low. You're looking about, for families, under 20,000. And a lot of them, as you would see, that they would not use need-based assistance because they probably not being have documentation, or probably not allowed to be able to get some of the needed services. And I'll discuss this a little bit later. But there's families that they're mixed households where you have the parents may be undocumented and the children are U.S. citizens, and the parents have fear of accessing services for their children because of being deported and being separated from their children. So where are they coming from, and where are they going? So on the map here of Mexico, and for the longest time, the majority of the farm workers were coming from the white states there. And my family's from actually the state of Colima there, the little small one in the corner there, right at the bend. But now, you guys are all going to Mount Vernon, and I'll be able to cover some of this. We're starting to see a lot of farm workers coming from the red states and Central America. So we're seeing a lot of indigenous farm workers coming up to the United States to work. About, I think roughly, they estimate about 20% to 25% of the farm workers coming up are indigenous farm workers. And like B mentioned, you're going to be dealing with individuals who may speak Spanish very little, if that, because they speak their native languages. Any questions so far? So where are they going? And I have a map here. You would think that they're going to the states that have a high agricultural area for business. And not a lot of people, when they think about farm workers, think about Washington. But if you go east of the mountains, it's just, that's where I ended up growing up in the Yakima area, and it's all agriculture. They tend to have in the Yakima area, I think, and I don't know what the demographics are right now, but it may be like 50% Latino, or Latinos may be the majority in Yakima County now. I think, or it's very close. And I put this map, this is kind of how the federal government back in the 80s, early 90s used to track farm workers. And you see the different colors. And based on this, there's funding allocation. You look at the western stream, midwestern, and then the eastern stream. And the theory was that farm workers are coming from the border states, and they follow the harvest up, and then they follow it down, and then they go back to their sending states or their sending communities. But they never really kind of captured that Mexico was there, and a lot of people were actually just coming up to work, and then they'd go back to Mexico during the winter months, or when there wasn't the harvest season was over. So you tended to have a lot of these farm workers who were not staying in the United States. They would come up just to work, make some money, and then go back home. And then after 9/11, with the border being tightened, you ended up having a lot of these individuals that couldn't cross back over. And during that time, you had a lot of farmers whose crops were basically lost because they didn't have these individuals to come and help them with harvest their crops. So there was a big demand for people to help these farmers. And you're having now individuals that are here in this country that they can't go back. So in order for them to continue to support their families in Mexico, are having to stay here in the United States, because it's a really difficult trek to go back and forth now because of the tightened security at the border. I put this slide here just to show you the different kind of moving around by migrant farm workers and individuals. So you're looking at the way some of the individuals, like I mentioned, the kind of nomadic one where they'd come from Mexico and they'd go up looking for work all over the place. And then you'd have that point to point, like if you lived in California, you'd go to Washington, and then you'd go work, and then you'd come back to California. When we lived in Eastern Washington, we had a lot of people that were coming from Texas that would drive all the way from Texas up to the eastern part of the state to work. They'd work there the beginning of spring, beginning of summer, and then go up to Mount Vernon, work there, come back to Yakima, and work there a little bit doing the apples, and then go back to Texas, and then they were done with the harvest. Our family would do that closed circuit where we would start again with, just like the individuals that were coming from Texas, we would start picking asparagus, which is basically going on right now, and then we'd work in. After that was done, we'd start picking cherries. When that was over, we'd move over to the Mount Vernon area, where we pick raspberries, blueberries, strawberries, Cucumber, and then that was about, that would end up ending around late to early August, go back to Yakima and start picking apples, and that would probably end sometime late October, early November. So we would do that every year. And then my father, because when the season's over, he would be the only one working in the winter pruning trees. So that was kind of what we did year in, year out for the longest time. So you guys are going up to Mount Vernon, and like I mentioned, there's been some changes in the demographics for farm workers, and you're seeing the majority of these farm workers that you'll see are Mexican, but you're seeing a larger percentage of these individuals coming from indigenous communities within Mexico. And again, they speak very little to no Spanish, so English is basically out of the question for most of them. And we're seeing individuals coming from Central America speaking a lot of native dialects as well. I was deployed down to the borders to help with unaccompanied minors, and we encountered so many different indigenous languages of these kids coming to cross the border. I remember with the language, the Hmong, we had one kid, because we couldn't communicate with him, we were trying to find some information, so we brought another kid that said that she spoke Hmong. They were both trying to talk to one another, and they kind of understood each other, but not really. And then once we started talking to the individual who spoke a little more Spanish, she said, "Oh yeah, he's from the lower part of the area where they're from. He's lower and I'm upper, and so I speak upper Hmong and he speaks lower Hmong." So it's like really interesting that that even within some of the indigenous dialects, there's variations. So I gave you some of the demographics of the communities, or the farm workers, just general demographics of farm workers. But when we're looking at these indigenous communities, they tend to be a lot more vulnerable than even their other farm worker counterparts. They tend to be younger, they're traveling with their families, and tend to have even a lower educational attainment, and very low literacy. And I'm borrowing these slides from, I think you guys will be working with Colleen Pacheco. She ended up letting me borrow her slides to be able to kind of shed some light on some of the indigenous communities that are in Skagit. Yeah.
So for the kids that can't work and are in schools, how do they do school when they have a nomadic schedule?
It's hard. You just bounce from school to school. That's kind of what we ended up doing for some time. I know that when, like I was saying, our school would start early August. We were coming back from Mount Vernon probably middle to late August, so I would always start, my family and I would always start about a month late into the process, which made it really difficult. And but we had teachers that were very understanding during that time. Also, we had a night school where I would come in, I'd help my parents work in the morning, come in at around noon, do the half day, and then stay another 3 or 4 hours in the evening, which, it required a lot of dedication because you're having to get up at 3 o'clock in the morning, work in the fields, maybe get a nap in or something, go to school for whatever, the amount of hours that everybody else was going to school, and then you get out, do your homework, go to bed, and do that. So it's very difficult, and there's different programs. I don't even know if this one's still around, but it really focused and worked with migrant kids. It's called the PASS program. I don't know if any of you guys have heard of that, but it allowed kids that were in high school to be able to take high school kind of credits on their own, to be able to make sure that they were catching up and were able to graduate on time. Because my brother ended up missing a whole quarter, and he wasn't going to graduate with this class, and he had to take these PASS programs that allowed him to get those extra credits to be able to graduate. And some states understand, they have a large migrant seasonal community, so they try to work with the parents and the students and the kids to make sure that they're providing that education for them. But it can be difficult, and I haven't been following up with what the issues are probably going on in Skagit with these children that may not be able to speak any English, but I'll tell you that little kids learn languages very quickly. And, we ended up learning English when I was a kid just by watching TV. I mean, you just pick it up, and so I don't know what's going on with the school districts there in Skagit, but I'm sure they're having their own challenges in trying to hire maybe individuals that can come in and provide some support. Any other questions? So, and then looking at some of the, like all the compounding issues and stuff that this community faces, and farm workers, you're looking at the life expectancy of these individuals in their country, in the native country, and then coming to the United States, and basically their life expectancy drops by 30 years. And you're looking at, and this is just for the indigenous farm workers, and when you're looking at farm workers in general, it's about 50 years, so a difference of 5 years. But when you're dealing with, physically demanding job, discrimination, being away from your family, pesticides, possible, falling off ladders or whatever, being run over by a tractor, all the possibilities of, or different issues that impact these communities. A lot of them may not be able to drive. There's just a lot of motor vehicle accidents, when they're traveling from one field to another. Just a lot of issues that compound that reduces their life expectancy. And so just, when you're dealing with this community, just understand that, it's very low literacy, lack of preventative health, and then, when you're talking, it's just going to have to be very basic. A lot of pictures. If you guys have any kind of information that you have, written material would be really difficult. A lot of pictorial stuff would be best. And I think Colleen probably will be able to help you guys with that. She has a good team of community health workers that are part of this community and know the community really well and will be able to help you. So I'll just cover some of the barriers here. So when you're looking at, especially for oral health, they're working very long hours, and it's seasonal. So a lot of times, like I mentioned, 12 to 16-hour days. It's seasonal, so if you have a health issue, or these individuals have a health issue, what they end up doing is they have a finite amount of time during the season to make their money for the whole year. So they will postpone getting any kind of health care during that time because they can't miss a day or don't want to miss out on work. So they'll work until the season's over and then try to get medical care. A lot of times, like I mentioned, people going, once the season's over, they would go back to Mexico. A lot of them were getting their health care there because they kind of understood the medical system there. They understood the prices, they could pay cash. In the United States, it can be a little difficult to understand what the cost would be of things, and there's a little fear of trying to go and get some care and then get this large bill that they may not be able to pay off. So they'll postpone care, and they're mobile, so they don't have a medical home. A lot of these individuals will, again, work during the harvest, go wherever they need to go, and then whatever receiving or wherever state that they're coming from, their community, they'll wait to go back there to get that care. And then most farm worker jobs don't have insurance. They don't have medical or dental insurance. And like I mentioned, half of them are not here or able to work here legally, so they wouldn't qualify for the Affordable Care Act or anything like that to be able to get insurance. But then even with that, they don't, the Affordable Care Act doesn't cover dental. Poverty, it goes to the cost of dental care is very expensive, or there's perception that it's very expensive. So I feel like they might not be able to afford dental care. Poor nutrition, which leads to a lot of health issues. You would think that this population who picks a lot of the fresh fruits and vegetables for this country would have access to fresh fruits and vegetables, but they don't. The location of the farm worker camps most typically are outside of town, so transportation is a big issue trying to get into town to get any kind of produce or any kind of supplies from the stores. And when you look at, I did a study for the state of Washington a long time ago around HIV and AIDS, and when we went to one of the camps, which was probably about 20-25 miles outside of town, and we were asking them questions, and one of the guys said, yeah, I wanted to go get tested for HIV because I had unprotected sex, and I was a little scared. Because I got out of work, I showered up, got my stuff together, and I was about to get into the car, and someone was like, oh, you're going into town. I want to go in town too. Can you give me a ride? So wait for me. And as he was waiting, another person passed by. He's like, hey, you going into town? I need a ride. And having limited transportation, he ended up having to drive everybody into town. And then he didn't want to get the test because he was afraid that people might see him going into the clinic, thinking that he might be HIV positive, and he didn't want any of the issues with stigma and stuff. So a lot of that stuff relates to transportation. And then these camps, they're outside of town, and they're not, they're using well water. They may not have adequate fluoridation in the water. So, and then dental clinics. You guys are doing some mobile stuff. These guys are working. If you're not meeting them where they're at, it's going to be really difficult to catch this population. And I'll show you some of the community health centers and where they're at, but a lot of the stuff that I've seen, these individuals, these health centers are there in place to be able to capture them and help them, and they're even put in places where the larger farm worker communities are located, but they're only capturing about 20 to 25% of these farm workers that are eligible to be able to use these sites. And they have community health workers, they have people that are bilingual and stuff, but it's just really difficult to convince these individuals to come out and go to government, any kind of government facility that may be kind of government, because they're really afraid to get deported or get caught or be part of the system. So they're really underground, and it's really difficult to reach those individuals. So, lack of bilingual, bicultural providers, and then looking at the indigenous languages, it's tough to get these individuals. And then getting professionals like yourself to go work in rural areas. I mean, you guys have, I'm sure, mounds of college debt that you want to pay off. To go to a rural area can be where you're not going to get paid as much. It can be really difficult, and you probably will be overworked and underpaid if you end up going on it. You got to really want to do stuff like that to help rural communities and have that passion. And then I kind of touched upon this, looking at the education, low educational attainment, low health literacy. So just not having the knowledge on preventative health, and really getting that ingrained into individuals. And like I mentioned, the whole season, they're waiting for the season to end to get care. A lot of them will not seek health care or dental care unless it's an emergency. And education, when I was in the migrant camps, we used to have kids coming out, college kids coming out to show us how to brush our teeth. I mean, I had people in our school that would come out and show us how to brush our teeth, because frankly we didn't do that at home. And then over the years, we ended up educating our parents to make sure that was an important thing that they needed to do. But education is a big key, and a lot of times they're not getting the importance of oral health in the countries that they're coming from. And this culture one that I added, the baby bottle tooth decay, really having someone that understands the farm worker kind of community and understanding farm worker work itself. You can talk to somebody and tell them, this is an issue for your kids. You don't want your kids to be in a lot of pain. They might have all their teeth removed. mean, you can tell them that, but they may not follow through with anything that you're telling them because, you know, when they go home, the reality is these women who are in charge of the, you know, the household and in charge of the children are also working alongside their husbands or their partners, and they're, you know, they have to do all the child rearing and preparing the meals and everything. So they're exhausted. I mean, they're working and doing all this stuff. The last thing they need is a crying kid. And so one of the things they'll do is, you know, give them the bottle, have them sleep with the bottle or anything like that. And when they're out, wherever migrant camp they're in, it's not like they have their own separate area. They may be doubling up or even tripling up with families. So having a child that's crying or screaming at night is probably not very good because these guys are having to get up early in the morning to go work, and it makes it really difficult. So that having like a community health worker that's from the community, possibly a farm worker, a former farm worker themselves, to be able to broach and have this discussion with a mother and have, you know, have her follow up through, you know, provide some guidance, follow through with it, and then check in with them from time to time really does help. So really having that person that's, you know, bilingual, bicultural, and understands the community really well will help reduce a lot of these issues and barriers that, you know, you're trying to provide them with this information, but the reality is when they're home, it's a different situation that they have to deal with, and they may not be able to follow through with all your instructions. So these were all, I put this up. Are you guys familiar with HRSA at all? Community Migrant Health Centers at all? So these are the safety nets basically that were set up a long time ago with individuals that don't have access to any primary health care. They're federally, they get their base funds from the federal government to be able to provide care for anybody, regardless of their ability to pay or insurance. And so they're all over the country. It's a great system to know because they're a great resource. I think some of you guys are going to be going to CMAR on Saturday, right? And CMAR is a community health center. They're also, I believe, a migrant. Some of their centers are designated as migrant health centers, and you guys will probably see those when you go to Mount Vernon. And that means that they get their base grant from the migrant program that designates them as a migrant health center or a community health center. And I think they also, the federal government through HRSA funds homeless clinics. And it just means that they're just getting their base grant from whatever pot of money that's it's coming from.
I just want to make a comment. I think these are the sites where you can get loan repayment too.
Exactly,
If you
and
work
I'll
here,
be
so.
touching on that and doing my recruitment in a little bit. So it's part of the fee for listening. You have to kind of hear my 5-minute spiel about recruiting you guys. So then when we're looking at, so this was the community and migrant health centers, all of them together. And then this is the migrant health centers and where they're located. And as you can see, and you might not remember, but when you're looking at the map of where these migrant farm workers are at and where they're going, those states that tend to have a large agriculture industry tend to have a large health centers because they're trying to serve these communities. As you see in the state of Washington, up probably up in the point up there north, that's CMAR, that's a possible CMAR clinic, and then all the ones that you see kind of in central Washington, that's probably Yakima Farm Worker Clinic, where they serve a lot of migrant farm workers. So looking at some of the different resources that are available, community migrant health centers, a lot of them have mobile dental clinics, and they hire community health workers. One of the things that the Washington Dental Association is doing through one of their programs is doing a lot of education with community health workers to go out in the communities and provide a lot of education around oral health.
I think it's Washington Dental Service Foundation.
Foundation,
Yeah.
correct, foundation, with Laura Flores contact, yeah.
Not WBC, so.
Yeah, I've been to at least a couple sessions where they're really trying to capture these community health workers and provide that education. They're doing pre and post tests on what they know and what they're doing out in the community. So if you guys wanted to get involved with them, I can try to connect you. And then the Migrant Head Start programs, are you guys familiar with those? So it's just, these daycare centers that are geared towards providing child care services for migrant farm workers. And that's where a lot of the screenings and capturing these kids happens. One of my sisters is a nurse, and she works with the Migrant Head Start program, and they do a lot of stuff with screening these kids because they want to capture them. They're there for a while. They do collaborations with the community migrant health centers to be able to provide any kind of services for these kids. And then here's my spiel here with the National Health Service Corps and also the USPHS, the U.S. Public Health Service. They do loan repayments, and they will, forgive some debt. But I'm not a total expert on the National Health Service, but if you go on there, I think I saw some, you do 2 or 4 years with their hope is that you would fall in love with the community that you're working with and end up possibly staying. But they do some loan forgiveness, and they put you in places called HPSAs. It's a health professional shortage areas. If they're designated as HPSAs, you would be able to get some loan repayment. And then I think with the National Health Service Corps, you can also do it if you're a U.S. Public Health Officer, which means that you get all the benefits that the military gets. You can retire at 20 years. Salary is very comparable to what you would see in the private industry. And you get, like I said, retire at 20 years, and you get a GI Bill, possibly be able to deploy if there's a major incident in the country to be able to provide help or anything like that. And it's been a great career for me. I've been in the U.S. Public Health Service for 4 years now, and I've done some incredible things that I never thought I would be doing. Or if I was in a hospital or a clinic, I would never have gotten the ability to get these experiences in, and I've only been in 4 years so far. I was deployed down at the border for the unaccompanied minors, went to Africa to provide medical support to health professionals in Liberia for Ebola, and then most recently I was in Flint working in the community there with the water crisis and what was going on there. So it just gives you that opportunity to use your medical background to be able to impact our community in a different level. And that's all I have. So if you guys have any questions, I'm really open to anything. Hopefully I didn't bore you guys.
No. I was just wondering, in general, is the status of health getting better or worse with time?
For migrant farm workers, it's kind of hard to say because if you look at the research and the things that are going on in the community, all the stuff is really old. So there's not a lot of focus on this community. You'll find some new stuff here and there, but it's fairly dated. There's not a lot of money being put in research for these communities. So it's kind of difficult to say. I mean, the structures, the community health centers are there, but really trying to get into those communities to bring them out, to seek those services is a challenge. I mean, you have to really put in the time and effort and establish those connections. And that's what you'll see with in Skagit area. Colleen's done a wonderful job in recruiting community health workers from the community, getting people that are trusted in those communities, because otherwise they would never be able to get in and have that. You have to really establish that trust with individuals, and you have to continue to build on it year after year, because it makes it really difficult to get into these communities if they don't know you. So I really can't answer that question.
They actually, when we've gone before, they've had translators who speak Tripoli or Mixtec. And that's what, if those of you who participate this summer, you will actually see a lot of this. It's quite interesting, and they're, because the younger age is basically healthy, and there is decay. There's some people have not ever had their teeth cleaned, and they have like calculus, like you know, you feel like you need a jackhammer to get it off, you know?
Yeah.
And it's,
Some of the older studies that I've seen is like you have individuals that like 50% of them have never been to a dentist, ever. I mean, maybe even, it was just incredible, and the amount of tooth pain that they'll suffer through or self-medicate is just, it's crazy to hear about some of the stories, but yeah, it's just, the medical is hard to access, and the dental is even more difficult.
You mentioned that it's hard for migrant workers to get back to Mexico to get to their families. What are the ramifications of like getting caught trying to get back to Mexico, and why is it hard for them to get back to Mexico?
Well, so if they're undocumented, I mean, they can go home
Yeah.
any time, but then trying to come back here. And the reason why they're here and working is they're sending money to their families. They're basically supporting the families. So if they get caught, they'll get deported. And my understanding of the process is they get caught again because they're fingerprinting photos and everything. They get caught again. I think there's up to 2 times, and they'll be deported again. The 3rd time they're threatened with being sent to jail or prison or something like that. And so most people by that point give up. And or what's happening is they're going further and further out into the desert areas where it's a little more treacherous and possibly not being able to make it into this country. So it's gotten really difficult, and there's been a lot of reported deaths or people missing because they're going out further and further trying to make it in the U.S. So it's been tougher. Yeah.
How does someone legally become a migrant assistant worker?
Legally, or how does a migrant farm worker become a U.S. citizen?
Or you mentioned that 50% of these workers are legally allowed to work.
Oh yeah. How are they legal? How are they working here even though they're undocumented?
Sure.
I'm not sure if I'm understanding your question, but if how are they legally? How are they working if they're undocumented? Is that what you're?
Or is there a way for an individual to legally work as a migrant worker?
Yeah, there is. They can apply for a visa. A lot of farm workers or farmers have applied for these H2, I think it's H2A visas to be able to bring farm workers into the United States legally. They have to. There's certain regulations and laws that apply. The farmer has to pay for their medical. I believe it's a higher salary for these individuals. There's all these regulations to be able to bring individuals into the country. There's got to be a need for this farmer, and then those individuals, once they're done with work, have to go back to Mexico. So a lot of times, if there's people here, instead of the farmer going through all those hoops and things, they will hire individuals that are undocumented to work. Might be pay them cash. People might have fake social security numbers or fake permanent or the temporary resident cards to be able to work in the United States. A lot of times people kind of overlook stuff like that. When I was a kid, I saw a lot of that with different farmers. They need their crops to be harvested, so they overlook a lot of things. And for the longest time, that's the way the system has been working. But you're right, there is a legal way of going about it, but it's more difficult and more costly for a farmer.